Good morning. I'm so grateful to be here. I'm so grateful that Rhonda Johnson has invited us, and I'm so grateful to be here with all of you who have taken time out of your day to be here, and I want to make that time count. I'm also right before lunch, so I'm going to keep it to 20 minutes. And no, that wasn't, we wanted to hear what you had to say, Dr. Clark. In addition, I am not an academic physician. I'm winging it. I've actually been a mom almost longer than I've been a physician. I am the mother of 9 children, 6 boys and 3 girls, and they're all teenagers. They've all been through teenage. I've had 2 teenagers left, and I know a lot about not disclosing the full truth. I am actually a Harvard-trained physician. I went both to Harvard College and Harvard Medical School, and I say that I'm in recovery from Preparation H. I went and became an internal medicine physician and then went on and did oncology. I had triplets during my oncology fellowship, and that derailed my becoming the great academic physician I thought I was going to be. I then retired about 3 years later after being and attending at my hospital in California. I retired to raise children because I kept having them. You should never sleep through lectures in medical school. So I have a practice in Westlake, and it's a private pay practice. I practice both internal medicine, but I also practice something called functional or integrative medicine, which people know best by, I'm a hormone doc. I prescribe hormones for people going through menopause and andropause. So the majority of my patients are my age and younger, in their 40s to 50s with teenagers. So I've thought a lot about TBI. I've thought a lot about my own sons and their football careers. I've thought a lot about my husband and his head injuries. And we decided to open a clinic, not actually totally based on the idea of TBI, but actually based on the idea that oxygen itself is medicine, and that oxygen is something I can write a prescription for, but in addition, pressure is something I can write a prescription for. And we wanted to create a clinic that would be Switzerland to all the physicians in the area, so that if someone wanted to prescribe oxygen and pressure, they could do it through us, and we would supply their prescription. And we opened this clinic, and we've been successful in doing that. I think my own patients are a very small percentage of who we see, and we get referrals from lots of functional and integrative physicians, but even from some surgeons who are looking to help bones repair, people who are looking for plastic surgery help. We actually have some urologists who are using us to increase the number of stem cells as a child goes into urologic surgery. I want to explain the overall landscape of hyperbaric and why this is such a strange thing. And I think it's a strange thing in the United States because hyperbaric therapy has been offered for 14 diagnoses that are established through the naval-based understanding of what is hyperbaric therapy. Hyperbaric therapy in the United States was started to treat people with the bends. When you go into the ocean and you go under pressure, it's very similar to being in a hyperbaric chamber, and the gases that you're breathing go into solution, and then when you come out too quickly, they come out of solution and you get emboli from the air that's now in your blood vessels. So you put the person back into a hyperbaric chamber, and that puts the gas back into solution, and the person avoids the complications. That kind of therapy is done in a chamber pressurized with 100% oxygen. That means if I go in and I move my knees together and I have on synthetic clothing, I can blow up the entire chamber, everyone around me, and there's significant loss of life. This is not a therapy I want to prescribe for routine things. It's not something I want to prescribe pre-op for a urologic surgery. It's not something I want to, because the chances of death, both to you and to me as the operator, are too huge. But there is, so that is pressures from 2.4 up to 6 atmospheres, and that's what's done in hospitals. Most recently, when they're building these chambers, they put them in an elevator. So you, the attendant, and the patient go down in the elevator, and if you blow up, we're fine up here. So there are other ways to do hyperbaric therapy, and it turns out that for neurologic conditions and for the conditions that I've just sort of given you an outline of, you can do pressures between 1.3 atmospheres and 2 atmospheres. But the very interesting thing in the literature in the United States is that 1.3 atmospheres, which is actually therapeutic, has been used as the control. So there are lots of studies in the literature showing that hyperbaric therapy is no better than the control. But the control was therapeutic. And that literature, the literature proving that it's actually therapeutic at 1.3 is coming from Israel. It's coming from China, although anyway, and it's coming from Russia, and it's coming from Europe. Okay, so just to tell you more about us, I think the most important thing is that we've been open for 2 years. We've grown from those 2 chambers there to having a 3rd chamber. We have tremendous demand on our service, and we've treated over 270 patients, and we haven't had a negative report. And people can buy a package, and they can quit, and then we will refund their money, and we haven't had people doing that. They buy a package, and they continue the package, and I'm thinking, they fight traffic to come sit in a chamber in Austin? Why are they doing that? Because they're getting better. All right. So how does a hyperbaric oxygen work? Oxygen is cash to your body. You have mitochondria in every one of your cells that is running because there's oxygen available to help you make the ATP that makes your cells work. And you need ATP to heal. You need ATP for just the general upkeep of your body. And if I give you more oxygen, now you have an unlimited budget. Think of what it would be like in a city like Austin where we are straining to deal with traffic. What if we suddenly had an unlimited budget to build new roads or to widen the roads that we had? We'd get right to work doing it. Why do we drive around in traffic all the time? Because our budget's unlimited. Is limited. So if you're trying to repair things in the body, if you're trying to fix things in your body, and I give you more oxygen, you will have the ability to get stuff done. You'll be able to build new roads. You might be able to build new blood vessels. You might be able to build new tissues and repair. All right, and how does that work? It happens because of basic gas physics. I alluded to this a little bit earlier, that gas under pressure goes into liquid. So if you are breathing oxygen under pressure, you will have increased oxygen in your blood. Well, wait a second, I thought hemoglobin carried my oxygen. Well, everyone in this room, if we tested you right now, you'd be 97 to 100% saturated. And there's nothing I can really do. If I put oxygen on you, I couldn't increase your oxygen saturation. I couldn't get more oxygen into you. But if I put you under pressure, something different happens. I'm actually now getting oxygen into your plasma, and it's not being carried by the beautiful system of a red blood cell with 1 million hemoglobin molecules in it. Now you've got oxygen circulating in the plasma itself. And the dramatic thing there is that that oxygen can get further than it can get if I'm delivering it from a red blood cell. I'll get to that later. Oh, just going back, our chambers are not pressurized with oxygen. They're pressurized with ambient air. And therefore, they are not bombs. And therefore, we didn't have to spend $50,000 on fire suppression or $100,000 on fire suppression. We don't have, the fire marshal doesn't have to visit us. We actually, you can bring your electronics. When I say this in a group of hyperbaric physicians, there's literal shaking in the room. But you can bring your phone, you can bring your computer, you can bring your if you still have a beeper, you can bring that. You can bring your child's devices. We can put a child who has a pump for, has pumps for various different things. We can bring a child that has a pump into our chambers, and we can have their attendant in there with them. Nobody has to change their clothes or take their nail polish off or remove their jewelry. We're not going to have it's not a bomb. And if the child is breathing oxygen, even the accumulated oxygen, the oxygen doesn't accumulate in our chambers. It continues to pass out because our chambers are continually outgassing. There is a third way to do this that's independent of freestanding stations like ours, and that is a market that's been growing over the last 15 years of parents who are asking to have chambers in their home. The other people that are doing this are the NFL athletes. And there are chambers that you can buy for your home that never go higher than 1.3 atmospheres. And a lot of those children are in those chambers without supplementary oxygen. So this is now a prescription for pressure only. And this is a child or an adult in a chamber on room air. I guess the most famous is Michael Jackson, but on room air for an hour to 2 hours at a time, once a day. And there is improvement seen in behavior and the neurological issues the child is having. So there are those three tiers. There's the 1.3 atmosphere market, there's our market, which is 1.3 to 2 atmospheres, and then there's the hospital market at 2.4 to 6 atmospheres. So this is my favorite slide. And I really only wanted to have this slide. I didn't want all the other slides. I don't know what they're useful for. And this just goes back to describe what it was I was telling you about. This is a blockage in a blood vessel. And there are some red blood cells that want to take oxygen beyond that blockage, but they can't. Okay? And now I've put the person in hyperbaric. This is probably somebody that's been in hyperbaric for 30 to 40 hours. And I've dissolved oxygen, the little small yellow O's in the blood vessel, and I've got oxygen in the blood vessel itself. That oxygen can now get past the blockage if there is still a vessel there. In an advanced injury at that point, there's probably just scar there. But I can also get oxygen into new blood vessels that are building. And the new blood vessels are building because I have increased the number of circulating stem cells in the patient. At somewhere between 20 and 30 hours, there's an increase of 500 to 800% of circulating stem cells. The kind of stem cells that people go offshore to get. But these are your own stem cells that have increased in circulation. And those stem cells also have oxygen present so that they can make bridges. They can do the work they want to do because they're oxygenated. What else is on there? So we have, what we're seeing here is neovascularization, or the growth of new blood vessels under the influence of hyperbaric. And those new blood vessels can bring blood to areas that need repair. So this is also another wonderful fact, which is that if I'm carrying blood on a red blood cell, on a hemoglobin molecule, I can get it to travel 51 microns away from where I want it to. If I've got that oxygen dissolved in plasma, the plasma can extravasate into the tissues a full 5 times further than that, or 570 or more microns. So I can actually get oxygen to tissues quite distant from the area. This is transformative in healing. And this is why this is so wonderful for plastic surgery. We have sort of a surgeon that does a lot of removing of implants from women's breasts. And the women heal 5 times faster because they're getting oxygen either before their surgery and after, or just after. So this is my one scientific slide. And I think the most important thing to understand is that hyperbaric oxygen therapy reduces inflammation, inhibits apoptosis, reduces intracranial pressure, and promotes neurogenesis and angiogenesis. Now, the reduction of inflammation, the inhibition of apoptosis, and the reduction of intracranial pressure are incredibly important in a newly injured child or a newly injured adult. That's probably not going to happen because that child's in a hospital, and actually putting them in pressure in a hospital hyperbaric chamber might even cause regression, because at those high oxygen tensions, the patient is going to experience some vascular constriction, and we may actually further injure. So it is not a good idea in the hospital. So we may not be able to get to an acute injury very quickly. But with regard to promoting neurogenesis and increasing angiogenesis, we can do that in distant injuries. There is no way to guarantee or to know, because injuries happen in so many different parts of the brain, injuries and scars, without seeing the brain in a pathologist table. It's very hard to know who's going to benefit and who's not going to benefit. And of course, if they're on the pathologist table, they haven't benefited. So I know that we're here from Hope4Minds, and I know that one of the very worst things that I could do would be to give false hope. And so I don't know whether we can help your child at all. And you will hear from many physicians telling you that this is useless. I certainly learned in medical school that a brain once injured was never going to heal. I think that in the last 20 years, we've really understood that there's neuroplasticity and that neurons do regrow and that there are new connections that can be made. I think it's incredibly important for all of us to sleep. I'm just putting in a plug for you, Dr. Clark, because when we sleep, we take out the trash. And when the trash is taken out, then I can reorganize and clean things up. So moms and dads who are trying to deal with children that are ill, you need to sleep too somehow. We need to get the cousins and uncles in to help. So, all right. And that last slide was hard to understand. And then here we are just trying to maintain our brains. How are we going to get enough oxygen to repair? And I think I've made that point over and over. But we can get more oxygen to the brain if it's dissolved in the plasma. So the hyperbaric studies that have been done in the United States have been done. It's very difficult to do a sham hyperbaric. And there's actually been some success recently in the last 2 years creating sham hyperbaric, where you can put someone into a hyperbaric chamber and convince them they've had hyperbaric when they haven't. So doing double-blind studies for hyperbaric has been very difficult, and that's why the low pressure of 1.3 was used. But we now know that 1.3, even without oxygen, is a therapeutic measure. But there is literature from other countries that is abundant, and it has been proven to be really the only proactive mechanism to regenerate new brain tissue. Recently, Joe Namath was on television telling people that he had 120 hours logged in a hyperbaric chamber, and that there was an MRI done of his brain before and an MRI done of his brain after, and that his left hemisphere, which had been shrunken and ill, was now regenerated and looked normal. So we have to go and look at those films. But that's the kind of story that we hear. After 20 hours, there is this fact that you have an increase in circulating stem cells, which is useful for everything that you might be interested in. This is done with a chamber that is pressurized with ambient air. This is safe. And this is financially prudent, although a typical course of 40 hours would cost about $4,000. If we can return the use of the right forearm, we are making that patient that much more independent. These are the reimbursable, insurance-covered, and there's nothing about brain on there. So these are the 14 that would be paid for, and insurance is reimbursing the hospital somewhere between $1,800 and $2,400 for that 1 hour. And if you're going to treat a burn, we're talking 30, 40 hours. If we're going to treat a diabetic ulcer, that patient might be in for 80 hours. And so we are spending that kind of money for injuries, but we're not thinking about the brain yet in the United States. In other countries, this is standard of care for concussion recovery, for PTSD, for TBI. This because it enhances stem cell activity. Well, no, because people are looking at doing surgeries pre and post hyperbaric to increase stem cells. So that's just a list of what's covered. There has been some work in looking at diabetics and saying, can we reduce their insulin requirements, and that's been shown to be true. So in all areas of medical application, there's room for a prescription for oxygen. This is our patient population. So here I am talking to you about neurological stuff, and we don't treat very much neurological stuff. Of course, I'm in Westlake, and so lots of wealthy people want wellness, and these are the ones that I can't believe keep coming back. So these are people without a symptom. I don't know whether they're there because maybe they're there because their friends are there. Maybe they're there because they go to happy hour afterwards. I don't know. But they keep coming back, and they send their friends. So for baseline normal people, it seems to be, if they can afford it, it seems to be something they want to do. And then you can see some of the other diagnoses. One of our doctors that sends us the most are people with mold toxicity. And the mold toxicity patients tell me that they were spending this, they were spending that, they were doing this, they were doing that. Now that they're doing hyperbaric, it's actually saving them money because their symptoms are gone, and as long as they're removed from exposure, they're doing much better. All right. I think I'm open for questions. Yes?
Is there a therapeutic effect, even, say, scuba diving?
Yes, there is. There is. And I think that's why Jacques Cousteau looked so young for so long. His metabolic syndrome was prevented probably by his hyperbaric, his exposure to oxygen under pressure. And people will say that they're addicted. They'll say, oh my heavens, I did this month-long vacation, and now I need to get back in the ocean. I need to get back.
Is there any way to do a localized effect, say like a scar on a portion of the body you can't?
The whole body has to be in the oxygen so that the lungs are exposed to the pressure. But that's a great question. Yes?
So how is it long after that to insult? So should I say stroke or surgery?
So I would say there is actually evidence, there have been a couple studies published of people pre-treating for stroke. So people who were in hyperbaric for a wound, who had 80 hours in, then have a stroke and recover from their stroke in a fraction of the time. So there's that data. There's other data, I would say as soon as possible. I really would. And there's a young woman in Chicago who is a mom like me who bought 2 chambers and is treating all the kids in her community for free, looking at TBI. And she's getting the kids in 12 to 36 hours post-TBI. And she's watching, post-concussion, she's watching them in the chamber recover as she's applying the pressure. And that would make sense based on the complicated slide, which showed that we are reducing all the inflammatory markers. We're preventing apoptosis. We're keeping cells that would be at the center. When a cell dies, the death of that cell sends out signals all throughout the body saying, there's a big emergency here, come inflammatory cells. And that piling on following an injury is part of further injury. So if I can get someone in an oxygen environment and increase the oxygen delivery to the injury, I can actually limit the size of the injury. And I can limit that apoptosis that would call the cell death that calls for more inflammatory cytokines.
I just very much. I was actually trying to get at if somebody has an acute, say, stroke or if they're doing surgery, you had mentioned that it's probably not optimal to do it immediately. Is there a period where it should not?
It depends on the pressure. In Russia, they are doing open heart surgery and they are doing brain surgery in hyperbaric surgical, in a chamber. So the surgeon and all of his assistants and nurses and circulating staff are all experiencing hyperbaric at room air. The patient is experiencing hyperbaric with oxygen. But those rooms are run at 1.5, where you're not going to have any vascular clamping.
Because the only kind of facilities you have in hospital theaters here are the 2.4 above pressures with pure oxygen. You just don't have the ability to do it here.
Yes.
Is there more risk because of that possibility of the neovascularization causing further injury?
This is a good question. So if the pressures are at 1.3 to 1.5, and there is very little risk to having any of that clamping take place. Okay. If we're following someone who is running at 2.0 in our clinic, and they come in and they say, I don't feel as well as I felt yesterday, we'll say, why don't you skip it today? Because if they're feeling fatigued or they're having any sleep issues, we don't want them to keep going. That may be a sign of oxygen toxicity. It may not be, but we're extra careful. Yes?
Do you decide the pressure for the person based on symptoms and what they're coming in for?
Yes, the doctor writes a prescription that tells me oxygen or no oxygen and what pressure.
Okay, so if I'm sending a patient to you, I have to put that on the prescription.
Yes. And there are some contraindications. I will get to your question. There are some contraindications. Anyone who has had a spontaneous pneumothorax or who has blebs in their lungs, so someone with any kind of a lung condition, I'm checking, double checking, I'm calling their surgeon, I'm making sure that the pleura is tightly, the lining of the lung is tightly adhered to the chest wall so that we don't, by putting them under pressure, actually cause a pneumothorax. There are also anyone with a sinus infection who's having trouble clearing their middle ear, they wouldn't be allowed to dive. So they won't be allowed to get in the hyperbaric chamber. So I'm looking at ears to make sure that they're not bulging. And I'm also trusting my referring physicians to do that. So,
Along with that same, I'm sorry. So I see a lot of sports injuries, tall, skinny athletes I don't maybe necessarily know have blebs.
Okay.
If I send one to you, do I just need to warn them of this risk?
yes, and we're watching them carefully. We're in communication with the patient while they're in the chamber. And in 1 hour at 1.3 to 1.5.
Okay, because if they come in for a concussion and they're a tall, skinny kid,
Right.
I have no idea if they have blebs, but they might.
Thank you.
This is awesome. We're going to need to go ahead and close the session.